and why they're particularly significant?
I think it's incredibly worrying. We've had 9 years now of year-on-year increases in relation to drug-related deaths. The death figures are at unprecedented levels and have been for a number of years now. I know that we've sort of tried to bring in a number of different measures, as we were talking about a couple of weeks ago, in regards to the new Home Office white paper, but it's clear that the current approach isn't working. We're seeing a awful amount of death. I think it was 4,839 people died last year. In Priti Patel's own words, that is more people who died more people died from drugs compared to knife crime and fatalities on the road combined. So it's a serious issue.
They must be predominantly young people as well, are they, Ant?
I think it could be anyone. You know, it could be sons, daughters, mothers, fathers, loved ones. This doesn't discriminate. I think the vast majority of people would be people with problematic use disorders. However, anyone can die of a drug death. So, yes.
So just help me to understand this a little bit then. So these aren't necessarily suicides. These aren't overdoses as such. When it's drug-related deaths, what does that mean?
So I believe they break it down into drug poisoning, and then there's some other factor, I think, for intentional overdoses. My understanding is that the vast majority of these, I don't want to speculate, I believe, will be accidental overdoses. Right. People who didn't set out to want to die because they injected that substance or inhaled that substance.
Yeah, Scotland has also seen a year-on-year increase as well, hasn't it? And is also at its highest drug-related death levels. Does this have to do with population rise? Does this, what's driving this? Because you could argue that more and more money and there's more understanding of drugs and addiction than ever before, and yet the numbers do keep going up and up. So clearly there's a massive critical failure somewhere.
Yes, I think so. It is, frankly, a national disgrace that the country as big as ours, has as big an economy as ours, has such bad figures compared to the rest of Europe. The UK has a drug death rate that is 3 times higher than the second country, which is Germany. And then Scotland has a drug death rate that is 3 times higher than the rest of the UK. There is definitely issues linked to poverty, to deprivation, but I think also a lack of policy making and a lack of education. So, yes, we're talking about these issues a lot, but we're not actually getting the funding and the policy change that we need to force these things through.
Something, Anne, has gone so horribly wrong, isn't it?